lifestyle related, environmental toxins, um, smoking, heavy drinking, as I said, drug abuse, men who take protein shakes and anabolic steroids, um, if there is heat exposure to the scrotal or inguinal area, like hot baths, saunas, jacuzzis, things like that, or tight supportive underwears, um, or prolonged cycling every day for many, many hours, anything which generates heat in the scrotal area could affect the sperm numbers and quality. Um, the other thing could be the controlling system. The brain controls the testicular function through two hormones called FSH, follicle stimulating, and luteinizing hormones, LH and FSH. So that hormone and that system could be at fault, and we call it hypogonadotrophic hypogonadism, that those FSH, LH hormones are not coming in adequate amount to stimulate the testicles. So that could be a pre-testicular cause. Or there could be some trauma to the testicles, or some operation on the testicles, or it could be torsion of the testicles as well, which can lead to defective blood supply and the testicular function gets disturbed. Uh, some boys, when they're born, their testes are undescended. So it could be on the one side or it could be on both sides. So if the testis is undescended and they're not in the scrotal sac, then they remain at a very high temperature closer to the body. And that is not good and ideal for sperm production. So that has to be recognized and corrected as soon as possible. So if it is delayed, then it could lead to a low sperm count as an adult. So there's a message in it that boys who have got undescended testicle operation as a child, they should check their sperm and semen analysis sooner after their puberty rather than later. Because if the sperms are there, they can be frozen as a backup, as a method of fertility preservation. Because sometimes, unfortunately, we see that men with these histories, specifically if it was corrected late, they come and we do not find any sperm in their ejaculate. And then obviously it could be obstruction. So infection is the commonest cause. So if somebody has got sexually transmitted infection or other infections in the testicular area like mumps. So mumps is a viral infection which leads to swelling in the neck, but sometimes in some cases it can affect the testes as well, and that can lead to testicular infection, and that can lead to obstruction and scarring, and the sperm are not coming out. So these could possibly be the reason: pre-testicular, testicular, and post-testicular causes.